Anatomy and physiology of pharynx. Pharynx in general. Pharynx is a conical fibromuscular tube forming upper part of the air and food passages. It is 12 to 14 centimeter long, extending from the base of the skull, basi occiput and basi sphenoid, to the lower border of the cricoid cartilage, where it becomes continuous with the esophagus. The width of the pharynx is 3.5 centimeter at its base, and this narrows to 1.5 centimeter at pharyngoesophageal junction, which is the narrowest part of the digestive tract apart from the appendix. Structure of the pharyngeal wall. Figure 47.1. Structure of the pharyngeal wall. From within outwards, it consists of mucous membrane, pharyngobasilar fascia, muscular coat, and buccopharyngeal fascia. Base of the skull, sinus of Morgagni, eustachian tube. From within outwards, it consists of 4 layers. Mucous membrane, pharyngeal aponeurosis or pharyngobasilar fascia, muscular coat, and buccopharyngeal fascia. Mucous membrane. It lines the pharyngeal cavity and is continuous with the mucous membrane of the eustachian tubes, nasal cavities, mouth, larynx, and esophagus. The epithelium is ciliated columnar in the nasopharynx and is stratified squamous elsewhere. There are numerous mucous glands scattered in it. Pharyngeal aponeurosis, pharyngobasilar fascia. It is a fibrous layer which lines the muscular coat and is particularly thick near the base of the skull, but is thin and indistinct inferiorly. It fills up the gap left in the muscular coat near the base of the skull. Muscular coat. It consists of 2 layers of muscles and 3 muscles in each layer. External layer contains superior, middle, and inferior constrictor muscles. Internal layer contains stylopharyngeus, salpingopharyngeus, and palatopharyngeus muscles. Buccopharyngeal fascia. It covers the outer surface of the constrictor muscles and in the upper part. It is also prolonged forwards to cover the buccinator muscles. Above the upper border of the superior constrictor, it blends with the pharyngeal aponeurosis. Killian's dehiscence. Inferior constrictor muscle has 2 parts, thyropharyngeus with oblique fibers and cricopharyngeus with transverse fibers. Between these 2 parts exists a potential gap called Killian's dehiscence. It is also called the gateway of tears, as perforation can occur at this site during esophagoscopy. This is also the site for herniation of pharyngeal mucosa in cases of pharyngeal pouch. Waldeyer's ring. Figure 47.2. Waldeyer's ring. Adenoids, tubal tonsil, palatine tonsil, lingual tonsil, nodules on posterior pharyngeal wall, lateral pharyngeal band. Waldeyer's ring. It is scattered throughout the pharynx in its subepithelial layer in the is the lymphoid tissue, which is aggregated at places to form masses, which is collectively called Waldeyer's ring. The masses are nasopharyngeal tonsil or the adenoids, palatine tonsils or simply the tonsils, lingual tonsil, tubal tonsils in the fossa of Rosenmuller, lateral pharyngeal bands, nodules in the posterior pharyngeal wall. Pharyngeal spaces. There are 2 potential spaces in relation to the pharynx where abscess can form. Retropharyngeal space, which is situated behind the pharynx and extending from the base of the skull to the bifurcation of the trachea. Parapharyngeal space, situated on the side of the pharynx. It contains carotid vessels, jugular vein, last 4 cranial nerves, and cervical sympathetic chain. Divisions of pharynx. Anatomically, pharynx is divided into three parts: nasopharynx, oropharynx, hypopharynx or laryngopharynx. Nasopharynx or epipharynx. Applied anatomy. Nasopharynx is the uppermost part of the pharynx and therefore it is called epipharynx. It lies behind the nasal cavities and extends from the base of the skull to the soft palate or the level of the horizontal plane passing through the hard palate. Figure 47.3 and 4. Divisions of pharynx and the vertebrae related to their posterior wall. Nasopharynx, oropharynx and laryngopharynx and the vertebrae related to the posterior wall. Figure 47.4. Rathke's pouch is represented by a dimple high in nasopharynx. Inferior to this, within the adenoid mass, is the nasopharyngeal bursa. Rathke's pouch, nasopharyngeal bursa, adenoids. Roof of the nasopharynx is formed by basisphenoid and basiocciput. Posterior wall is formed by arch of the atlas vertebra covered by prevertebral muscles and fascia. Both the roof and the posterior wall imperceptibly merge with each other. Floor is formed by the soft palate anteriorly but is deficient posteriorly. It is through this space, the nasopharyngeal isthmus, that the nasopharynx communicates with the oropharynx. Anterior wall is formed by the posterior nasal apertures or choana, separated from each other by posterior border of the nasal septum. Posterior end of the nasal turbinates and meatrices are seen in the wall. Lateral wall. Each lateral wall presents the pharyngeal opening of the eustachian tube, situated 1.25 cm behind the posterior end of the inferior turbinate. It is bounded above and behind by an elevation called torus tubarius, raised by the cartilage of the tube. Above and behind the tubal elevation is a recess called fossa of Rosenmuller, which is the commonest site for origin of carcinoma. A ridge extends from the lower end of torus tubarius to the lateral pharyngeal wall and is called salpingopharyngeal fold. Figure 47.5 and 9. Figure 47.5. Endoscopic view of nasopharynx showing torus tubarius in the lateral wall of the nasopharynx. Note also the fossa of Rosenmuller, which lies behind it. Fossa of Rosenmuller is the commonest site for the origin of carcinoma nasopharynx. Figure 47.9. Pharynx opened from behind, showing the structures related to nasopharynx, oropharynx. Choana with turbinates, eustachian tube, salpingopharyngeal fold, soft palate, the posterior surface, forms the nasopharynx. Tonsil and base of the tongue forms the oropharynx. Laryngeal inlet, pyriform fossa, postcricoid area forms the laryngopharynx. Nasopharyngeal tonsil or adenoids. It is a subepithelial collection of lymphoid tissue at the junction of roof and posterior wall of nasopharynx and causes the overlying mucous membrane to be thrown into the radiating folds. Figure 47.1. It increases in size up to the age of 6 years and then gradually atrophies. Nasopharyngeal bursa. It is an epithelial lined median recess found within the adenoid mass and extends from the pharyngeal mucosa to the periosteum of the base occiput. It represents the attachment of notochord to the pharyngeal endoderm during the embryonic life. When infected, it may be the cause of persistent postnasal discharge or crusting. Sometimes an abscess can form in the bursa, Thornwald's disease. Figure 47.4 showing the nasopharyngeal bursa. Rathke's pouch. It is represented clinically by a dimple above the adenoids and is reminiscent of the buccal mucosa in vaccination to form the anterior lobe of the pituitary. A craniopharyngioma may arise from it. Tubal tonsil. It is a collection of subepithelial lymphoid tissue situated at the tubal elevation. It is continuous with the adenoid tissue and forms a part of the Waldeyr's ring. When enlarged due to infection, it causes Eustachian tube occlusion. Sinus of Morgagni. It is a space between the base of the skull and upper free border of the superior constrictor muscle. Though it enters the Eustachian tube, the levator villi palatini, tensor villi palatini, and ascending palatine artery, branch of the facial artery. Figure 47.1 showing the sinus of Morgagni. Persimmon's ridge. It is a mucosal ridge raised by the fibers of palatopharyngeus. It encircles the posterior and lateral walls of the nasopharyngeal isthmus. Soft palate during its contraction makes firm contact with this ridge to cut off the nasopharynx from the oropharynx during the deglutition or speech. Epithelial lining of nasopharynx. Functionally, nasopharynx is the posterior extension of the nasal cavity. It is lined by pseudostratified ciliated columnar epithelium. Lymphatic drainage. Lymphatics of the nasopharynx, including those of the adenoids and pharyngeal end of the Eustachian tube, drain into the upper deep cervical jugular nodes either directly or indirectly through the retropharyngeal and parapharyngeal lymph nodes. They also drain into the spinal accessory chain of nodes in the posterior triangle of the neck. Lymphatics of the nasopharynx may also cross the midline to drain into contralateral lymph nodes. Functions of the nasopharynx. It acts as a conduit for air which has been warmed and humidified in the nose towards its passage to the larynx and trachea. Through the Eustachian tube, it ventilates the middle ear and equalizes the air pressure on both the sides of the tympanic membrane. This function is important for hearing. Elevation of the soft palate against the posterior pharyngeal wall and the Persimmon's ridge helps to cut off the nasopharynx from the oropharynx. This function is important during swallowing, vomiting, gagging, and speech. It acts as a resonating chamber during voice production. Voice disorders are seen in nasopharyngeal obstruction and velopharyngeal incompetence. It acts as a drainage channel for the mucus secreted by nasal and nasopharyngeal glands. Oropharynx. Applied anatomy. Oropharynx extends from the plane of hard palate above to the plane of hyoid bone below. It lies opposite the oral cavity, with which it communicates through oropharyngeal isthmus. The latter is bounded above by the soft palate, below by the upper surface of the tongue, and either side by palatoglossal arch, anterior pillar. Boundaries of oropharynx. Posterior wall. It is related to the retropharyngeal space and lies opposite the second and upper part of the third cervical vertebrae. Anterior wall. It is deficient above, where oropharynx communicates with the oral cavity, but below it presents base of the tongue, posterior to the circumvallate papillae. Lingual tonsils, one on either side, situated in the base of the tongue. This may show compensatory enlargement following tonsillectomy or may be the seat of infection. Valleculae. They are cup shaped depressions lying between the base of the tongue and the anterior surface of the epiglottis. Each is bounded medially by the median glossoepiglottic fold and laterally by pharyngoepiglottic fold. They are the seat of retention cysts. Figure 47.6. Base of the tongue and valleculae. Median and lateral glossoepiglottic folds. Valleculae. Tonsils. Base of the tongue, sulcus terminalis. Circumvallate papillae. Lateral wall. It presents palatine or phaseal tonsil, anterior pillar, palatoglossal arch formed by the palatoglossus muscle. Posterior pillar, palatopharyngeal arch formed by the palatopharyngeus muscle. Both anterior and posterior pillars diverge from the soft palate and enclose a triangular depression called tonsillar fossa, in which is situated the palatine tonsil. Figure 47.7. Various structures seen in the oropharynx. Soft palate, anterior pillar, posterior pillar, tonsil, circumvallate papillae. Posterior pharyngeal wall, uvula. Boundary between the oropharynx above and the hypopharynx below is formed by the upper border of the epiglottis and the pharyngoepiglottic fold. Lymphatic drainage. Lymphatics from the oropharynx drain into the upper jugular chain, particularly the jugulodigastric tonsillar node. Soft palate, lateral and posterior pharyngeal walls and the base of the tongue also drain into the retropharyngeal and parapharyngeal nodes. From there to the jugulodigastric and posterior cervical group. The base of the tongue may drain bilaterally. Functions of the oropharynx. As a conduit for passage of air and food. Helps in the pharyngeal phase of deglutition. Forms part of vocal tract for certain speech sounds. Helps in appreciation of the taste. Taste buds are present in the base of the tongue, soft palate, anterior pillars and posterior pharyngeal wall. Provides local defense and immunity against harmful intruders into the air and food passages. This function is subserved by subepithelial masses of lymphoid tissues that are scattered as Waldeyer's ring. They are strategically placed at the portals of air and food entry and act as protective sentinels. B lymphocytes in the germinal centers of the follicles produce secretory antibodies of IgA class, whereas T lymphocytes in the parafollicular region produce cell-mediated immunity against various viruses, bacteria and fungi. Pathogens which happen to enter into these lymphoid masses are dealt by IgM and IgG antibodies that are secreted by the plasma cells. Hypopharynx or laryngopharynx. Applied anatomy. Hypopharynx is the lowest part of the pharynx which lies behind and partly on the sides of the larynx. Its superior limit is the plane passing from the body of the hyoid bone to the posterior pharyngeal wall, while the inferior limit is the lower border of the cricoid cartilage where the hypopharynx becomes continuous with the esophagus. Hypopharynx lies opposite the third, fourth, fifth, sixth cervical vertebrae. Clinically, it is subdivided into three regions: the pyriform sinus, postcricoid region, and anterior pharyngeal wall. Pyriform sinus or the fossa, it lies on either side of the larynx, extends from the pharyngoepiglottic fold to the upper end of the esophagus. It is bound laterally by thyroid membrane and the thyroid cartilage, and medially by the epiglottic fold, posterolateral surfaces of arytenoid and cricoid cartilages. Figure 47.8. Normal pyriform fossa, right and left arrows. They show better when the patient phonates. It forms the lateral channel for food. Foreign bodies may lodge in the pyriform fossa. Internal laryngeal nerve runs submucosally in the lateral wall of the sinus and thus is easily accessible for local anesthesia. It is also through this nerve that pain is referred to the ear in carcinoma of the pyriform sinus. Postcricoid region. It is the part of the anterior wall of the laryngopharynx between the upper and lower borders of cricoid lamina. It is a common site for the carcinoma in females suffering from Plummer-Vinson syndrome. Figure 47.9. Laryngopharynx having pyriform fossa and postcricoid area. Posterior pharyngeal wall. It extends from the level of the hyoid bone to the level of cricoarytenoid joint. Lymphatic drainage. Pyriform sinus is richly supplied by lymphatics which exit through the thyrohyoid membrane and drain into the upper jugular chain. Lymphatics of the posterior wall terminate in the lateral pharyngeal and parapharyngeal nodes and hence to the deep cervical lymph nodes. Lymphatics of postcricoid region also drain into the parapharyngeal nodes but may also drain into the nodes of the supraclavicular and paratracheal chain. Rich lymphatic network of pyriform fossae explains the high frequency with which the nodal metastases are seen in the carcinoma of this region. Functions of hypopharynx. Laryngopharynx, like oropharynx, is a common pathway for air and food, provides a vocal tract for resonance of certain speech sounds and helps in deglutition. There is coordination between contraction of the pharyngeal muscles and relaxation of cricopharyngeal sphincter at the upper end of the esophagus. Lack of this coordination, that is, failure of cricopharyngeal sphincter to relax when the pharyngeal muscles are contracting, causes hypopharyngeal diverticulum.